Well, I would love to talk to you today about your experience with healing. You've been in the manual arts of hands-on therapy and chiropractic for close to 35 years, over 35 years. Is that right? 40 years?
44 years,
Oh my goodness.
1976. Yeah,
Just a wealth of information.
that's right. A lot of experience, hundreds of thousands of treatments we've
Oh
figured
my
out.
God.
Yeah, yeah.
How would you define or describe healing? It's a big question.
That's huge. Um, the word itself, of course, bring to wholeness, and so I like to see my work as connecting with the physical, mental, emotional, and spiritual dimensions of someone. And so one of the things that interested me when I began was sort of the all of the stories that we hold in the body that can prevent or cause dis-ease and discomfort and pain and so forth. So I spent a lot of time in doing body-oriented therapy, Reichian therapy, and bioenergetics, and Gestalt, and all this kinds of things. And so there was that component to it. And as a chiropractor now, I've really done my best to keep that, approach, so that I schedule, like, for example, I schedule follow-up visits for 15 minutes, which is kind of unusual for most of us chiropractors. Usually it's a pretty quick intervention. We do these powerful adjustments and make huge changes. But I like to just take a time with patients to just sort of, well, how are you?
Mm.
And how's it going, right? And, well, God, my mom just had a stroke, and I'm really kind of stressed out. And okay, wow, I'm sorry to hear that. And the other dimensions of her person. So I have a lot of discussions with patients about that it's okay, and we invite them to feel their feelings. And it's, how do we connect with that spiritual, dimension that is hard to describe for most people outside of a church, religious context, and how do we describe it? Because we can connect with that in a way that really promotes a feeling of well-being. In addition to, oh yeah, your C5 was restricted on the right, and we're going to get that lined up, and that, which is really cool as well. So it's like pain management. But the healing then comes really from a deep connection with another human being. And it's interesting for me right now because I'm, after 44 years, I've written a couple books, and one of my books is in its second edition, but I'm going to do another book about, I don't know exactly what it'll be titled, but something about the language of the body, that the body is speaking to us all the time. And I'm fluent in that language. And for example, one of the beautiful things is I can travel around the world and work on people of different cultures and different language. I don't speak Quechua when I was in Peru, but I know the language of the body. I know how to treat it. And so I'm saying that because now I'm telling my patients, I'm going to take 18 months off of my practice. And I'll tell you what, it's a really emotional thing for both of us.
Yeah.
It's like, wow, it's like, yeah, oh my God, no. I mean, I'm happy for you, but oh my God, and I'm like, oh my God, I get kind of emotional because it's like family.
Yeah.
And I love that, rather than, okay, hey, I'll crack your neck and okay, see you tomorrow, or whatever. It's really, I've developed relationships with these people. They're like my family of patients. And so that healing then is that connection with people. People know that I care about them, about their lives and their well-being. And so to me, that is like the heart connection, which is sort of the center of the healing to me. It's about the heart and about compassion and kindness. And so, as you know, I've developed a technique where you can do really powerful therapies, but with a kind touch.
Yeah.
And that to me is really, really healing. I could go on.
I just love to listen. I just love to listen. It reminds me of the wonderful and insightful talks you would have at the beginning of class, where we'd all be standing in circles. We'd be
Yeah.
in our hip circles, our kidney circles, and we're like, I'm just here to listen to Tom talk,
Right.
to see what insight just channels through.
Right. Right. Yeah. Well, I'm always listening, to the
Mm-hmm.
message of the universe, and I feel like I can, be a vehicle of sharing that message.
Mm-hmm. Yeah,
Yeah.
that coming from the heart is such a place that isn't really talked about in chiropractic school,
Right.
and I think we've talked about this a couple times when we had dinner with you of like what's going on with the chiropractic profession, where students are coming out and they're like, I don't even like chiropractic anymore.
Right.
Like it didn't get their heart. And I'm in the place now where I still do Hendrickson Method on pretty much all my sessions, 99% of my sessions. But then I'm also wanting to go like straight just to chiropractic because like of another technique that I'm learning, but it seems like there's less heart in that. And like you're saying, it's just like opening that up again for me. Like I really enjoy taking time with my patients.
Yeah.
And that was the hardest thing for me to leave my practice in San Francisco was, why am I leaving my family?
Right. You really get that. Right. Yeah.
it still sits with
People.
me.
Yeah.
Hmm. And
That's
they
right.
feel that. I mean, like you said, like there's this connection that they
Yeah.
see that we deeply care for them.
Yeah.
Um, yeah, and that's just such a huge part. I mean, you've had your practice within the same block for
I know. For a long, long time, maybe 35 years there, right in that
yeah.
neighborhood. Yeah. Institution.
Hmm. And how would you talk about consistency? I mean, we could talk about it about your daily practice, which you've had for close to 45 years as well.
Right.
What has driven you to be consistent in your own self practice and then also being able to provide just incredibly loving care for your patients?
Well, I've been blessed with some very powerful, what would be called mystical experiences in my life, and one of the most profound was right at the beginning, 1976. I'd been doing yoga for 2 or 3 years at that point, and part of how I got into, I was supposed to be a professor of literature. I have a master's degree. I taught at the college level and high school level, and I was starting a PhD program in literature,
Hmm.
and I started taking classes in yoga. And I had experiences in those early yoga classes. This is Kundalini yoga, so it's
Hmm.
intense breath work, and you go into kind of these altered states if you're allowed. And I had some experiences there with this vibration and energy that was just like overwhelming. It was like, oh my God, what is this? Because I had some of these experiences, in my in the days where I was doing psilocybin and some LSD, and one of those of that generation. And so I
Hmm.
had these experiences that were like, oh my God, okay, the universe is a vibrating field of energy. You really kind of get that. And then the quantum physicists finally end up saying exactly the same thing.
Yeah.
Well, I had these experiences in my yoga, and then I went to a meditation retreat. And so this was, I'm forgetting, either a 7 or a 10 day, and I will tell you that I had this pain behind my heart in about day 3, and it got worse and worse and worse. And I thought, oh my God, something's really wrong here. I mean, I thought, okay, it's a rib, or I was kind of on that level. But then I was like, no, this is really bad. I mean, I felt like a crushing, but I'm young, I'm not having a heart attack. God, I'm in good shape. And I went to one of the teachers there who said, okay, Tom, now for the rest of the retreat, your entire attention, I want you to put it on the pain. No other field of awareness, just the pain. Well, and also, by the way, do not move. Don't
Vipassana. We're
move.
talking about Vipassana here.
You're right, right?
Yeah.
And and so I did. I was dutiful. I followed the instructions, And it got worse and worse and worse and worse. And at one point, I really thought, okay, something's going to break here. And it exploded into light, and I dissolved. And the pain went away, never to return. I could have sat there, and I did, for hours and hours and hours, because I didn't have a body anymore. Well, that keeps me coming back. That kind of experience, and I've had a number of those. So my daily practice is like, it's almost like, my analogy is like, I have an appointment with the energy of the universe, with the divine. And am I going to show up for that meeting? Am I going to have a relationship with the divine? And I'll say, she wants to meet me every day, every morning. And am I going to show up? Oh yeah, I'm going to show up.
Yeah.
You know, I mean, this is incredible that there's this, I feel like there's this invitation. And then through yoga and meditation, and I also practice Tai Chi, as you know, and through this, I have this energetic streaming, this circulation of energy that comes through me that is like a taste, and it's a reminder of like, I am part of the fabric of the universe. And it's very palpable. It's very physical. It's not like an idea. It's like, it's something that, you know, is very, it draws me to it. It's like a magnet. It pulls me to it.
Mm-hmm.
And so in a sense, I don't have to think about it. Luckily, I'm
Mm-hmm.
too tired. I was up too late. I'm not feeling like whatever it is. Oh no, I'm meeting in the morning with the divine, and I'm going to have a conversation through my yoga and through my meditation. And she's always there. It's amazing. I've never been stood up. Not
That's
once.
great. To be stood up by the divine would be a pretty funny comedy bit. I don't know.
That would be really funny, wouldn't it? It'd be a great sketch on that one.
So it's like I mean, to put it in simple terms, I guess it's like you're using your body as a vehicle to then get in touch with that divine fabric. Like you said, you don't have a body, but yet you're using that as a vehicle to get back in touch with that incredible energy that's everywhere.
That's right. Well, I got my body back after that incredible experience, you know, because I couldn't, well, I don't know, maybe some people do stay in that state, you know, forever. They just kind of, oh, they're gone, you know, but you come back. But it's interesting because, and I want to do some writing about this because it's interesting because it's the sensations of the body that are part of the language of the vibration of the universe. So most people, of course, as we know, aren't really in their bodies.
Yeah.
And then people that kind of are in their bodies, it's like they don't really notice unless they hurt.
Yeah.
But what so many of us know is that the body is filled with sensations and streamings and pulsings and vibrations and all the time.
Yeah.
It's all the time. Well, if we get really quiet and feel that, the membrane, the boundary between our body and the universe dissolves. And it's like, okay, you know what? The whole universe is vibrating. The whole universe is pulsing. And I'm part of that. So if you enter the field of sensation, then it doesn't have to be associated with feeling like, oh, I'm feeling elated or depressed or anything. It's like, oh, I'm feeling vibration. Well, stay with that. And, oh, I feel this little pulse in my feet. We'll stay with that and see. And more and more and more I have found is, you know what? The universe is doing the same thing. And so now there's this union, there's this communion, right? So that informs what I do, because when I connect, when I touch with another, I know that I'm touching the fabric of the universe through that person. So it's pretty cool. And the fabric of the universe is behind me. So we're all like this web, you know, the spider web that we're bending in our connection, but it affects everything, since everything is connected to everything.
Yeah.
It's kind of quantum physics 101, right?
Yeah. Yeah. There's no separation.
There's no separation. There's no boundary.
Yeah. Multi-dimensional.
Right.
And then how do you, then when you're talking with a patient that might not be in their body and they come in for you to see you with pain.
Yeah.
And you have the language of the body, how are you communicating with them about that pain?
Well, that's the art of it, isn't it?
Hmm.
Because each person has a kind of level of understanding, or a level, like a little window where I can see into them a little bit. And for so many patients, it's just really um, very basic. Like, okay, listen, let's talk about your pain.
Hmm.
And what I want you to practice with me, and I'm going to coach you on this, is how do you relax into this pain? And because I'm just going to give you an example, because they might be avoiding it, as most
Yeah.
people do, pain avoidance
Mm.
behavior, right? Oh, well, my knee hurts, so I'm not walking anymore. And oh, I can't even walk across the room anymore because it's like, you know what? Let's have a relationship with the pain that I can help coach you with, where it's not to be avoided, but it's to be befriended. Because this pain is going to talk to you. And if you can learn to relax into it, you can able to learn to move through it. So sometimes it's like that kind of a conversation.
Hmm.
And a lot of times, as you know, it'll be like, oh, I think my shoulders, hurting. And, I came in because, I don't know, I think it's maybe aligning. And we have to tell them, you know what, it's not your shoulder. You have an inflamed disc. And this isn't like, I'm just going to push your shoulder back in line. This is going to take us a while. And we're going to have to really be careful with this. And it's going to require some patience on your part. What? Oh, it's my shoulder. Feels like shoulder, doesn't it?
Yeah.
It's not. And this is complicated.
Yeah.
And you're in the right place. I can help you out, but you got to be patient with this one. So it's like education on that level.
Hmm.
And then, for so many, it is about, I've had so many patients, as who's like, oh, I hate my hip. It's
Yeah.
always bugging me. I just hate it. And
Hmm.
so there's that fight
Yeah.
going on.
Hmm.
And how do we, and so part of my coaching is like, you know what? I want you to take the role now that you're the mother of your body, and your body is a sick child. And she can't use words. And I want you to mother her and take care of her, because you would with a sick child, right? You would take care of her. It's like, well, yeah. Well,
Hmm.
your hip can't use words, but it's talking to you. And I want you to be like a mom and take care of your baby. Okay. So it's like, oh, okay. So I can kind of move them like, oh, okay. I don't hate it anymore. It's like, oh, it's like a sick child. Oh, okay. All right. I can get behind
Hmm.
that, depending on
Yeah.
where they are. And then for some, it's like, okay, they know about the body, they're yoga teachers or something. And, oh, okay, let's talk about the pattern of, well, this muscle gets tight and this one goes weak. And the hip tends to be fixated anteriorly. We need to tighten your gluteal, so we can have
Hmm.
that kind of a conversation, and really an education, which is, as you know, what the word doctor means is teacher. So to teach people, about their body. And so you have to kind of find the way into where you
Hmm.
can connect with them.
Yeah, and that just comes with many years of being observant, right, of the type of patient,
Yeah, yeah,
of just like which one works. If they're more, yeah, exactly. If they want to learn something more, if they just kind of want to give the healing up to you.
right. And that's okay.
Hmm.
Sometimes, yeah, lie down and I'll take care of it. That's okay too.
Yeah,
It's just like where they are.
and how would you? Because I know I sometimes go into this. What advice would you have for chiropractors or any healer or any body worker to not take blame and don't take shame? Is that what's right? Or don't take fame and don't take blame? Like it's really not. I don't want to take it all myself. As it's my responsibility.
Right.
And so how do you kind of meander that with um with being a doctor, with being a chiropractor? Of yes, they're coming to see me, but it's how much of it is my responsibility?
Yeah, well, that's a good question, and it is challenging because, the principle you're talking about is so important, and that's kind of the basis of karma yoga, right? Is
Mm.
we do our work, but not be attached to the results. So I will tell my patients, you know what, I'm going to do the best job I can. And I think I might be able to help you. And so let's work together and we're going to try it, and then they come back 2 or 3 sessions of whatever it is, and say, you know what, it's really not any better. And then for me, it's taken a long time, right, to learn, like, oh man, did I screw up, or did I miss something, or did I like what? And at this point in my career, typically it's like, you know what? I think we need to get an MRI here because I think there's something going on. Or I think maybe you should try some acupuncture just to like calm your whole nervous system. Or have you tried Feldenkrais, to just kind of chill you out, or whatever it is, more diagnostics or something. The challenge though comes, and I'm used to get more irritated with this, and now at this point in my career, it's not as much irritating, but when the patients blame me or they're dumping on me,
yeah,
I don't like that.
Yeah, how do you deal with that? What's an example of that too?
Wow, what is an example of that? Well, I mean, just the very simple thing. Maybe I could think of a specific example of but you said that, you said that you were going to help me, and it's not any better, and they're all angry. And I said, no, wait a minute, just listen. It's like, I'm doing the best I can, and this is not working, so you're not getting any better. And instead of inviting you just to be patient and do some more treatment, you know what? I think that we should identify a different practitioner. And for some of those patients, well, no, I'm sorry, I've been angry, and then, or some would say, yeah, well, what would you recommend, So then I do have some, I mean, there are a couple of stories I've had. I don't know if you've ever dealt with this, but I had a patient walk in, and I'm pretty much on time in my practice. So I really value people's time, but obviously I can't, guarantee that I'm going to be right on time, right? Well, I was, this was a number of years ago, but I was 10 minutes late to the appointment. That's not too bad, right? And this patient was pacing the room. Oh. And before he even said, hi, my name is whatever, she said, I will not tolerate this. And so I just put the chart down. And like, not tolerate what? Being held up like this. And I will absolutely not tolerate it. So you have to be on time if you expect to have me as your patient. And I said, oh, well, I can never tell you that I'm going to be on time. I'm never going to guarantee that. This is the wrong office then, because I'm going to try to be on time, but no, I can never, ever guarantee you that I'm going to be on time. So why don't we just call it a day? And she did. She left.
Yeah.
Thank God. I don't know. We don't need patients like that, right?
No. Yeah.
Try to appease her and calm her down. Oh, no, forget about
it. Yeah. I had one like that. My office manager at the time, when she actually left the patient, she's like, oh my God, I've never heard anybody talk to you like that before. She just seemed irate. And there was a part of there was, I wanted to keep her out of a sense of financial.
Right.
And that was like, okay, now she's got to go. She's got to go even more.
Well, the early days, we're building a practice, and there are those pressures. And so I treated a lot of patients I wish I didn't in the early days as well. It's paying the bills. So, but blessedly, if we just stay with it, we get a following, and, we don't have to tolerate that anymore.
And my understanding of you and is that your practice has always been built upon referrals. Like, you've never done any advertising except for just incredible results and a loving, tender touch.
That's right. No, I've never, ever had to advertise. And I feel like my best advertisement are my patients. And so also another thing that is, really interesting about my practice, I had, one of my main mentors, even before chiropractic school, I spent years training with, as you know, this remarkable physical therapist, who was a former mechanical engineer named Lauren Barry. I ended up training with him and wrote a book about his work and worked side by side with him in his office. And he really didn't like chiropractors. And the reason he didn't like chiropractors is they keep you coming back over and over again, you know? And it's interesting because I did one like clinical rounds day at Kaiser one time. A friend of mine was a physician there. He said, yeah, hey, come on by. It'd be interesting, you know? And it's interesting because the physicians there, and there were, I don't know, there were maybe 20 physicians there, neurologists and orthopedists and everything. And they didn't have any real complaints about that. What we did was effective. It was like this repeated visit kind of thing. And of course, we do need to repeat visits on so many of our patients.
Yeah.
But one of my philosophies is, and I tell my patients is, you know what, I'm going to do the least number of treatments to get the job done. And then I want to encourage you to do some maintenance care so we can really keep you in optimum health. And when patients heard that, it was like, you're kidding, right? You know, and I said, no, I'm serious because I want you to be self-reliant rather than dependent on me. And we had a funny story from Claudia, my office manager of 30 years, who recently retired. And she told me that a patient came out to the front desk one time and said, oh my God, it must be serious. Tom wants me to come back. And it's like, oh my God. You know, so then once you say, you know what, I think you're doing really well. Why don't you check with me and, you know, maybe a few months, you're doing great. Just get, well, they refer in their partner, their husband, their friend, their relative, because it's like, wow, this guy fixed me up and he didn't want me to keep coming back. So I think that's a great marketing tool, actually, rather than to set up a whole program for them, no matter what their condition is. You're going to see them 3 times a week for the next 6 weeks, no matter what, you know?
Yeah. It's kind of a bummer because it's put that into a lot of the public of chiropractors are just these rack 'em and crack 'em type of, you know, things.
Yeah. Not what we want to do.
And you work with your patients. You always do motion palpation first. You always check from the pelvis to the sacrum, and you go up pretty much every segment, depending on what they come in with. But I believe that you go in every segment just to see.
Yeah.
But can you talk to your philosophy about the health of the spine? Yes, being a chiropractor, but then also the importance of that and how that radiates out to the rest of the being.
You mean why spinal health is so important?
Yeah. Because I mean, you could. I would just love to hear your take on it for the listeners, because it's going to be shared with other chiropractors and things. But yeah, the importance of spinal health and how that is just.
Well, I'm with DD and the whole philosophy. Oh my God, it's like the you know, the center of vitality of the human body is the nervous system. And in order to have a well-functioning nervous system, we have to have a well-functioning spine. You know, that there are profound influences on the motion of the spine to the function of the nervous system. So restrictions of motion, I'm of the camp of, you know, talking more in like fixation rather than subluxation, because I can feel that. And the restriction of motion, those restriction of motions have a huge, like Malik Schlossberg and many others have incredible documentation of you know, what goes on there, but huge influences to not only the surrounding muscles, but the whole organ system, you know, so you have restrictions in thoracic spine, and you're going to end up with, you know, diminished capacity and diminished neurologic function to the heart and lungs and the other viscera, depending on the level. And so, and this is, you know, and as practitioners of yoga, as we know in the yoga tradition, you know, they say, well, we measure a person's health by the flexibility of their spine.
Yeah.
It's like, wow, what a good measure, you know, because you could be 20 years old with a super rigid spine because you sit at the computer playing video games your whole life. And you could be 70-year-olds and have a really flexible spine and have incredible vitality because you've maintained spinal health. So that's why I'm also a big believer in doing movements that promote spinal health, even just walking. I had so many of my patients, including my mom, who passed away a few years ago, but she was solid and healthy and vibrant and a ton of energy. She never went inside a gym in her whole life, never took a yoga, but she walked. She
Mm-hmm.
walked. And so while she couldn't touch her toes or whatever, well, she didn't need to. She had incredible health, and she had a healthy life right up to the end at 95 years old. And so it's like, you know what? It's pretty simple. And then if you want to have really optimum health, really, really high level of health, well, then you need to, invest in like a yoga practice for spinal flexibility or some program that really improves your spinal health, because it's key. Yeah.
Mm-hmm. Yeah. Yeah. I just wanted to hear you say it because I know the importance of spinal health as well. I mean, it's chiropractic philosophy 101, depending on which chiropractor and which philosophy you're looking at, of course.
Right. That's right.
Mm-hmm. Because even working with the extremities on patients, the importance of checking the spinal level as well and making sure, since they're already in there, they're on your table.
Oh, absolutely.
Mm-hmm.
Yeah, because obviously the neurology is really basic, that you're dealing with a knee, for example, or something. Well, you better check the nerves that innervate the knee, because
Mm-hmm.
you might have some neurologic disturbance that's really causing, those quads to go weak and the hamstrings to go tight. And you keep like adjusting the knee of, getting that tibia or fibular head or something set. But unless you know that, okay, you know what, better check that both lumbar and sacral plexus to make sure that L3, 4, 5 is really functioning well, or you could have some central disturbance, along the spine that's never going to allow that knee to get strong and stable.
Mm-hmm.
So for any of the extremity joints, absolutely.
And you were talking at the beginning about your relationship to emotions, spirit, and mind. And when you're working with somebody and they're stuck on that physical plane, and there's some emotional component. I know I deal with this on the weekly basis with patients. It's like, well, how are the stresses of your life? And they don't really want to go there, but yet
Yeah.
the emotional has such a big part of people's pain and their attachment to it.
Yeah.
How do you then, you might have already mentioned it, but how do you then take that conversation into that in a place that allows people to see that
Well,
relationship?
it depends, because, I think we want to be invited in or be open to that kind of a conversation. And because, like you say, some patients, they just don't want to go there.
Yeah.
And to me, that's okay.
Yeah.
But I will point out to them, for some, it's like, I really feel some anger inside of you. And I really encourage you to get some support to deal with that. Talk with a friend or a therapist, or find some way to express it, because I think that's really causing this chronic neck pain you have.
Mm-hmm.
And then, oh, okay, all right, yeah, no, I think you're right, and that's all they want to hear. Then, like, well, what do you mean? And well, about whatever,
Yeah.
And guy, one of my great stories, from my life that kind of influenced me. I had one of my mentors was a woman named Muriel Chapman, who was the first female osteopath in California.
Mm.
And this was many years ago. And she was well into her 80s when I met her. And at the time, I was in just beginning chiropractic school, and I had a woman that I was treating, and she had neck pain. And so I was doing some soft tissue work and all this stuff. And it wasn't getting better. And I had trained with Lauren Barry, so I was doing some manipulations, a little on the side, but, usually very successful. I wasn't getting anywhere with her, and just stuck. This is like 3 or 4 treatments. And I had an appointment myself with Muriel Chapman, because I love to have her just do some work on me. And I said, you know what, can I bring you up to Muriel Chapman? And I described her. She said, oh, sure. Well, so we went up there, and Muriel walked into the room and looked at this woman and said, oh my goodness, dear, you have so much anger. And this woman burst into tears. And Mira came over, oh my dear, that's okay, that's okay. And then just lied her on the table and rubbed her. She was bawling. Well, the neck pain was gone. Muriel just saw it, just kind of laser beamed right in there with loving compassion. Well, I didn't see it, and I couldn't get to that depth. So to show you how if somebody's open and somebody can kind of just dive in there, wow, that can be so potent. And then her neck pain went away. So, I mean, it could be that direct, but for so many, it's like, just to say that, I think you're really having a lot of emotional challenges right now. And I feel like you're holding those emotions. And well, you might be right, or whatever. They're like, oh, they don't want to go there. So let's put you on your side. As you know, in my method, it's, we put people in fetal position and just rock them. And it's okay just to feel what you feel. Just allow yourself the feelings, whatever is going on. And it's okay, just, it's like weather. It just comes and it goes, and just, and so I'm rocking them and just kind of, just give yourself permission just to feel what you feel. And I'll tell you what, I see a lot of tears even with that, just giving them permission.
Yeah.
And that, I'm not looking at them. We're not making contact. They're in their own world. They're in the fetal position. But you know what? It's like somebody sees what's going on and gives them permission to have that sadness or something. So sometimes it can be like through the side door.
Yeah, or straight.
Right, like Muriel, just like laser beam. Oh my God.
What are some, I was asking Jennifer, like, hey, I'd love, I'm going to be interviewing Tom. And she said, well, ask him to talk a little bit more about some Lauren Berry stories.
Oh.
Some of his incredible healings. I remember the one where he put the guy's eye back in his socket, and just that confidence.
It was a ligament. Yeah. So that's one. So this was a mailman who was hit by a car and damaged pretty badly, and broken bones. He was hospitalized and with breaks and so forth. And but he came to see Lauren afterwards, and Lauren fixed it all up, and so he came in at one of the sessions and said, yeah, doing really well. There's one weird thing. I don't know if you can do anything about it, but I have this pain in my eye, and I went to the eye doctor, and they can't, and my eye works fine. And Laura said, will you hold on a minute? So he went out and washed his hands up again, and then came back in, and he put his pinky finger at the bottom, and he stuck it deep into the socket and of this guy who was just like totally trusting him, and did this little flip move. And he said, yep, there it is. Sure enough, one of the ligaments holding your eye was misaligned. And so it was in a twist. And so I realized, he said, damn, Lauren, that's it. The pain's gone. I had one of the most dramatic stories with Lauren Berry was we were in class, and we used to have, there are a couple of them, patients that he would do as models, it's like a clinical rounds. Well, this man, they got out of the hospital, who was they had already been reading him his last rites because he was having kidney failure. And they brought him in. They had to lift him up to bring him in. This was a patient of Lauren's father. They brought him in, and Lauren, put him on the table and started palpating around in his viscera. And he said, yep, just as I thought, your kidney's misaligned. It's dropped. It sits in a little nest, the kidney. And if it drops out of that nest, it's not going to work right. So he put him on his side and did this kind of move into his belly and pushed up. And then the guy came back the next day, and you know what? He had a little more color in him. So he was like gray when he came in. Oh my God. It was just really, really rough. He came in, oh my God, okay, a little more color. Day 2, did it again. Day 3. The guy's walking in now, a spring in his step.
Mm.
I mean, he brought him back to life. It was unbelievable. By day 4 of the workshop, he's like, I feel great again. Thank you. You know, it's like, oh my God. So it's just unbelievable, the
Yeah.
kind of stuff that,
Yeah. How does one get to that? I know, like when I'm adjusting patients, they're like, so what was it like to learn how to do a cervical or a neck adjustment in school? That must have been very scary. And I can imagine the same thing of like, well, what does it feel like when a kidney's out of place?
it's
Like how does one
feeling.
navigate that?
I actually did this. I taught a workshop. I have a group of students in England that love my work, and so I went over there last year, and there was a woman who had an injury, and she said, I cannot figure out. I have this like chronic fatigue now, and no one can figure out what it is. And and sure enough, so what you do, you get on the sideline position, and you know, say on the left side, and you put one hand right over the last rib, the 12th rib area, and your other hand is like a really soft fist with your soft thumb is leading, you know, and you push up like you're pushing into your other hand,
Hmm.
and you should have a real resilient feel. It should have a real spring to it. But if the kidney is dropped, there'll be a resistance barrier there. There'll be, you know, it's like a dried out sponge a little bit. You know, it's like, ooh, it doesn't have that spring anymore. So sure enough, I did these movements. Same thing. I mean, she came in next day. It's like, oh my God, I have all this energy. I was up for hours. I couldn't believe it. And after a few days, she's like, it was all better.
Huh.
And
Yeah.
go ahead.
I was just giggling because I remember when I took a workshop with you, I had a lack of energy, and you said, "Oh, I got just the thing," and you had me sit up on the edge of the table, and you rubbed my back, and you hit the backside of my body
Right.
so hard,
Right.
it woke me up.
That's a great technique, isn't it?
Jennifer, my wife, was like, "What was that?" Like, Tom just woke me up. I'm back in the game.
I learned that in Kundalini yoga. We used to do that for each other. Give
Mm.
a big, you know, you have to do it with the appropriate person. You don't want to, but you're a strong bloke, and so I could smack on you hard.
We had some relationship before that, so it was good.
That was good. Yeah, you don't want to do that on your new class member.
Yeah, yeah. Well,
Hmm.
it's just like thinking outside of the box for a lot of chiropractors and manual therapists of being able to trust in so much of ourselves, of our what we believe healing is about. And I'm just getting that sense from you because you've had so much experience with your own work and working with other patients that, and since we're all part of this fabric, that as long as we come in with this loving, kind, tender intention, that so much can happen within that field.
Yeah.
And even just talking about how to like adjust someone's kidney or adjust someone's eye, there's so much more too than we were talking about just the spine. There's the viscera, and there's this whole being,
Right.
um, that's such a self-practice thing that we didn't learn in school,
Right.
that I think we could get so stuck in our heads about. And I just love that we've been able to have this conversation to help open up what healing is about.
Right.
Um,
Yeah.
yeah, because so many chiropractors I feel like have lost that that reason why they wanted to become a chiropractor.
Yeah. It's sad because it's just an incredible profession. I'm so grateful. I say my gratitude prayers regularly because it's you know, it's you know, one of the most important gifts we can give to the planet is to help relieve the suffering in this
Hmm.
world, and that we get to do that one person at a time is it's a very very huge blessing. You know,
Hmm.
so I count my blessings because my relatives on my mom's side, they were coal miners in Wales,
Wow.
and I could have ended up in a coal mine, right? If with a different life. And
Yeah.
here I am helping to relieve suffering in my patients. Like, wow, how cool is that?
Hmm.
And I've also we got to stay curious, I think, in the profession. It's easy to get into a routine and just kind of do things by habit and
Yeah.
not really be curious as to who this person is we're treating and what's going on with them besides their low back that you've treated for 10 years or whatever it is, and just to see the other dimensions, to be curious about the other dimensions, is I think something that we each need to stay with. Otherwise we get stale. We get into a habit, we get into a routine. It can happen in relationships, and many other things can in relationship to our work, where it's just like, oh yeah, this neck pain again, rather than, okay, here, let me touch this neck and see what we find today. Let's see what's going on here. And then what I love to do, as you know, is with my patients, because I do have this time with them in soft tissue. It's like, so what have you been doing lately? What's going on, as I'm working on their neck.
Yeah.
Oh, well, I just had this really cool trip to whatever, or, oh, I'm really struggling with my mom who has dementia. And so then it's like, okay, now we're into, their being, they're sharing their life with me, rather than I'm just touching their splenius capitis or something there. We're into a connection that, to me, is people need to be heard and feel like they're important. And a lot of times we don't get that. We don't get that at work. We don't get that often in our relationship. We get kind of either taken advantage of, or just, it's like the same old relationship. So for somebody to really be curious and really pay attention and really interested in a person is a huge gift that we give them. And then we can get them out of pain and get them feeling good. Oh my God.
Yeah.
It's really, and it's too bad. We've had, as chiropractors, we've had a tough history, so demeaned by the medical profession and by many others. It's a very sad chapter. And so I'm glad it's turning around, where the science is really behind us now. It's like,
Yeah.
okay, there are really good reasons why these adjustments are so powerful. But, obviously those that have preceded us, they had a tough struggle, to, feel like the medical community, the other healthcare providers thought they were quacks, that's a rough place to be. So we have a lot of very courageous people that have walked, that were standing on their shoulders, that took a lot of heat on our behalf so that we could be in this, accepted by the healthcare community as being a valuable member. It's a big deal.
What another question I have is any beliefs that you think that some people in healing might have about what is possible with healing? Is there anything that you've heard that you're like, oh, that's actually something that maybe you should kind of change your belief around? Or is there anything that you've seen about people, how they view healing that just doesn't seem right?
Well, without getting into names, one of our colleagues out there who was filling huge hotel rooms, and a big following, on one of his, I don't know if it was a YouTube thing that was posted on one of his seminars. He said, I've discovered a new energy in the universe, and I'm the only one that can tap into it. And so I'm gonna, you're gonna pay me lots and lots of money for me to show you. And so when you listen to, like, what is it? It's, of course, he's not discovering any new energy, but he's putting the old wine in a new bottle and selling it. And that's
it's a great analogy.
And it's like, oh, for heaven's sakes, no, And there are, unfortunately, there are charlatans, that are there really to, they're interested in money. They want to make a lot of money, and you can make a lot of money in chiropractic. You can make a lot of money saying that what you do is absolutely no one else on the planet does, and that you've discovered something that only you have access to. And
Hmm.
I don't know, that's very egotistical and arrogant. And so my philosophy is there are a lot of wonderful techniques out there, like even in the chiropractic profession, or
Yeah.
especially in the profession. Oh my God, fantastic techniques. There's so many good things out there. Well,
Hmm.
fabulous. And so just find what you resonate with and go into it deeply. Go sink deep into it. I also get a little frustrated with some, I've known um, chiropractors who do the smorgasbord, they do a little of this and a little of that and a little of this, and then they do all kinds of things with their patients. And my philosophy is different. I think that, it's that old story of Patanjali, about the two farmers that were looking for water in the neighboring properties, right? And so one farmer's digging for water a little bit, and no water. So he finds another spot, digs another hole, no water. He digs another spot, no water. He keeps doing this. There's all these holes all over his property.
Hmm.
And his neighbor goes in, he digs water, no water, digs a little deeper, no water, digs deeper, water. So go
Hmm.
deep with whatever you're doing, and then you can add things to it, but have something with some real depth to it.
Yeah.
Is the way to, I think, because any system you do, if you go really deep in it, can really provide very deep results,
Yeah.
rather than something that you're doing the smorgasbord approach.
Hmm.
I went to one seminar, and oh boy, it was on 8K. This is years ago. I won't mention any names, but but the head of the teacher said, "Well, if you want to come back from lunch a little earlier, I'll show you some great tricks I use to to improve your clientele, your patient population." So he came in and he said, "Okay, now the voice is really important. Okay, so you got to listen to my voice and the tone and everything." So he had one of the classmates on the table, and like, "Now your neck problem is very, very bad, and it's going to take you a long,
Jeez.
long time for this to heal, and I'm going to need to see you regularly, and it's going to be emotionally very tough on you. So I want you to
Wow.
invite your friends to come into the clinic and see me as well, because they will be able to support you." I mean, oh my God.
Just the power of suggestion and manipulation right there.
Oh, it was so gross.
I'd rather have my lunchtime back than hear that again.
Thank you. Really. Oh my God. And of course, these are just, every profession has
Yeah.
their, the size, but we have so, most of our colleagues are so heartful and want to help and are really dedicated and devoted.
Mhm.
And so it's a fantastic profession to be in. Anybody who says, "Oh, I want to be a chiropractor," I'm like, "Oh my God, you are such a lucky person that
Yeah.
you have that desire, because this is an incredible, incredible profession."
Hmm. I
Yeah.
say that and I go, and the school's a little tricky.
The school can be tough. Oh my God,
Oh,
I know.
Jesus.
Yeah, it's really
Whew.
tough.
Yeah.
I know.
But
Yeah.
it birthed what I do. It birthed all my teaching, and you helped facilitate that with the adjustment that you gave me that lit up that magnificent message, the clearest message I've ever had in my life of go to chiropractic school. And
That's pretty cool. Yeah.
mhm, yeah, it was
And the
profound.
bop on the back. Hey, geez,
Yeah, that
two
kept me in line. That kept me in line.
two moments. Wow.
Well, is there? I got two questions. We have limited time here, but I mean, you could
Hey,
pick whichever one of these. Either, what advice would you have for new chiropractors stepping into the field, or what book are you currently reading?
oh, well, I'll take the first one. I'm reading so many books. I've got a lot of great books I'm reading. But my encouragement would be to, I think the continuing education classes after our chiropractic education were absolutely key.
Hmm.
And so I would encourage the student to find continuing educations in the field that, you know, they were really interested in, whether it's sports or neurology or orthopedics or AK or craniosacral, or I mean, we could go on and on.
Yeah.
But find something that you resonate with, and that you really feel aligned with, and because that teacher hopefully will be offer a great deal of experience and insight into not only that particular technique, but into the profession itself, to find that teacher as a mentor that can kind of coach you in terms of, you know, the practices, you know, building a practice and how to handle patient management and all those kinds of things.
Hmm.
So that would be one of the main things that I would suggest to them. Keep studying, keep learning.
Yeah. Never stops. Just because you get that diploma on the
Never
wall like I
stop.
got here doesn't mean it's like, oh, okay, got it down.
That's right. That's right. Exactly.
Well, thank you so much, Tom,
Yeah,
for
you're welcome.
taking this time to be here on the Men with Heart podcast, but also your dedication to yourself and to your patients. It's really beautiful to hear it again. It's been so many years since I've been in one of your classes, but this is a real beautiful, healthy reminder of the reason why I got into chiropractic in the first place.
Nice. Thank you for that.
Mm-hmm.
Beautiful. Well, it was really fun
Mm-hmm.
hang out with you this hour.
Yeah. Thanks, Tom.